Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
NSAIDs are very commonly used drugs. They're used for arthritic pain, they're used for inflammation, they're used for autoimmune diseases as add-ons, they're used for fevers. The problem is they're not without issues, real issues for your health. An example would be ibuprofen or naproxen. Millions of people casually take these almost on a daily basis. Now, they increase your risk of a heart attack. They can increase your risk of developing a blood clot. They increase your risk of heart failure. They even affect your hearing and your vision. They can damage your kidneys. They can trigger asthma attacks in certain people. So I'd like to discuss this today so people know what they're up against, because I think basically the toxicities and side effects of these drugs are just shrugged off by most people. So welcome to my episode, NSAID toxicity and actual really good substitutes for them. There are alternatives. Hi, my name is Jerry Hickey. I'm a nutritional pharmacist. I'm also the Senior Scientific Officer over here at Invite Health. I want to thank you for tuning in today. You can find all of our episodes for free wherever you listen to podcasts, or visit invitehealth.com/podcast. Now, they tell me that I should ask you to subscribe, but I think if you like these podcasts, you'll probably subscribe on your own. You can follow us on Facebook, Twitter, and Instagram at Invite Health, and all the information on this episode is linked at the episode description. So I want to get going here. Millions of Americans use NSAIDs. You could pull into a gas station where they have those quick serve little stores and buy NSAIDs. Honestly, they should only be sold in pharmacies. All of them come with a black box warning. The next time you get a prescription for celecoxib, the next time you get a prescription for any NSAID, for ibuprofen, next time you buy ibuprofen, the next time you buy naproxen sodium, look at the paper inside. And right on top is the highest level of warnings from the FDA. If it gets any worse than this, they recall the drugs from the market. So it's called a black box warning. So I'm going to read you the current black box warning, the updated black box warning. Cardiovascular risk. NSAIDs increase the risk of serious and potentially fatal cardiovascular thrombotic events. That means a blood clot. Now, they said potentially fatal, including heart attack and stroke. Risk may occur early in treatment and may increase with duration of use. In other words, over time it could get worse and worse, more dangerous. But it can happen within the first 7 days of use. GI risk. Now, that's the digestive tract. GI stands for gastrointestinal tract. NSAIDs increase the risk of serious and potentially fatal gastrointestinal adverse events, including bleeding, ulcers, stomach or intestinal perforations. GI events may occur at any time during use and without warning, especially in elderly patients. So, when you take these drugs, they increase the risk of posterior subcapsular cataracts. They damage your hearing. They commonly cause tinnitus, ringing in the ears as a side effect. But if you get off them, usually the tinnitus goes away. But they do increase your risk of hearing loss by up to 20%. Now, age and loud noises are already affecting your hearing, so you don't need an added problem. They increase your risk of a heart attack somewhere between 40 to 60%, including other cardiovascular events. They increase your risk of heart failure by about 60%. In pregnant women, they increase the risk of miscarriage by 80%. They can cause allergic reactions. They could trigger asthma attacks in certain people. They trigger terrible kidney damage. Bleeding ulcers, most of them cause bleeding ulcers. So common drugs would be ibuprofen, naproxen, naproxen sodium, aspirin, diclofenac, celecoxib. Now, they're NSAIDs. NSAID is an abbreviation, it's an acronym, non-steroidal anti-inflammatory drugs. In other words, they're not related to steroids like Decadron, like prednisone, like hydrocortisone. And they do reduce pain and inflammation. They work by inhibiting these froggy-looking chemicals that the human body makes in balance called prostaglandins. Now, certain prostaglandins are needed to protect the lining of the intestines and the lining of the stomach. So when the NSAID inhibits these prostaglandins, that's why you could wind up with these vicious, dangerous bleeding ulcers. About 19,000 people a year die from those ulcers in the hospital caused by these drugs, by the way. You don't hear about that. That doesn't account for the people who die outside of the hospital from this type of severe intestinal damage. And they promote blood clotting so that you don't bleed to death. So there are problems with this. But the prostaglandins affect your kidney. And like I said, when you use these drugs, you can have severe problems with the kidneys. Now, we have an enzyme family that creates these prostaglandins. They're called COX enzymes, cyclooxygenase enzymes. There's the COX-2 enzyme and the COX-1 enzyme. Only COX-1 produces prostaglandins that activate platelets and protect the stomach and intestinal lining and the kidneys. But you also need COX-2 for later stages of healing. So the NSAIDs are so powerful that they block these COX enzymes, they just throw everything off balance. So the new guidelines, by the way, it just came out a week or two ago, the new cardiology guidelines. NSAIDs such as aspirin should not be used for primary prevention of a heart attack since the harm caused by the drug outweighs the good. But that data, it's really getting downplayed. It's really getting ignored. Pharmaceutical companies ignore it. When I took pharmacy in the 1970s, I had this brilliant professor, Dr. David Lynch, genius. The guy had so much packed into his brain. He was just a genius. And he said these are rescue medications. They didn't even use that term yet. He started that term. And he said, in other words, if you have severe arthritis pain in your back or your knee, you could take the drug for 3 to 5 days, but using it for longer than that is dangerous. Yet somewhere along the road, somebody decided, hey, it's okay to use these dangerous medications every day. Now, some people are stuck with using them. For instance, the disease lupus is very dangerous. It could destroy the kidneys, it could destroy the heart, it could destroy other tissues. Same with some other autoimmune diseases. So, in actuality, these people using drugs like ibuprofen or naproxen is better than having the disease. But for you and me, it might not be so. So if you have a mildly irritated, painful knee, there are natural things that will help that pain that are not dangerous for you, and we'll go on into that later in this episode. So one of the reasons why American doctors are not paying attention to the side effects and toxicities of NSAIDs is because a lot of research is published in Europe. It's not reaching here. They're not taking it seriously here. Now, the other thing is, this is weird. The drugs don't prevent the knee from getting worse. The drugs, like Advil, Aleve, Celebrex, they don't prevent the knee from getting worse and worse. So even though they're helping you with the pain and the stiffness today, you're still losing joint tissue. You're still losing knee cartilage. So eventually, even though you're on these drugs, you're going to need knee replacement surgery possibly. But there's weird research showing that these drugs make the joint worse. There's a couple of studies that came out in the past year that show that these drugs that they use for arthritis pain actually advance the disease. They actually accelerate the loss of joint tissue. They actually decrease the joint space width. So I don't know if it's a good thing. We need more research to prove that, but there is evidence that they make your arthritis worse overall. Now, commonly the side effects, so we spoke about toxicity, heart attacks, heart failure. I didn't even mention high blood pressure, damage to the kidneys, triggering an asthma attack, damage to the eyes, damage to your hearing, bleeding ulcers in most of the drugs other than celecoxib, which is Celebrex. But they commonly cause upset stomach, nausea, stomach cramps. They could cause other things too. They cause fluid retention so that your legs swell. And like I said, they cause tinnitus, ringing in the ears. They can affect your breathing, cause shortness of breath, but they also cause photosensitivity, which you never hear. Photosensitivity means it's easier to get a sunburn. That's what that means. So, what do? There are true supplements that really work for your knee that actually seem to slow down the loss of joint tissue, that actually seem to protect the cartilage. One of them would be undenatured type 2 collagen. It's called UC2. You take one a day in the morning, either with food or without, so you can take it with your breakfast or on an empty stomach. It pulls the immune system away from the joint. It seems to help prevent the joint from getting worse, but people with mild to moderate pain, the pain is generally gone within the first month. People with really severe knee pain, the pain's generally gone by the second month. I've even had about 5 or 6 people with bone-on-bone arthritis, according to their orthopedic doctor, tell me that their bone-on-bone pain went away using the cartilage, using the UC2, the undenatured type 2 cartilage. Collagen, I should say. So let's get back to this. Another supplement that can really help you is well-absorbed turmeric. Don't just buy curcumin. You want the complete plant. The research from Baylor University and Baylor Medical Center, which are 2 different places, shows that the complete plant is much better for treating an arthritic knee than just using the curcumin alone. Because there's other ingredients that are great for inflammation, like bismuth-oxycurcumin or aromatic turmerone. These work as well as the curcumin. So you want the complete plant. When you get the turmeric plant, only 3 to 5% of it is curcumin. There's all these other ingredients in there. So you want but you want one that's well absorbed. Because we humans, we poorly absorbed turmeric and curcumin. Now, another plant ingredient that really helps is frankincense. The turmeric, the well-absorbed turmeric, there's several of them on the market. Like there's one where they mix it with the black pepper fruit extract. There's another one called biocurcumin. They work really well. They're really well absorbed. They're very good for arthritic pain. The frankincense is called Boswellia serrata. That's the Latin binomial name that you'd see in the textbook. And ingredients in it called acbas are great for the inflammation you see with arthritis. So let me come at this from different angles. The drugs work with the COX-1 and COX-2 enzymes. The turmeric, the well-absorbed turmerics like the biocurcumin or the curcumin mixed with the black pepper fruit extract, they work with the COX-2 enzyme, but they don't completely erase it, so it's still there to help with the healing. So you don't get the side effects with well-absorbed turmeric that you get with the drugs. But what about the Boswellia serrata, the frankincense? That works in a different pathway. That works in the lipoxygenase pathway. So you're coming at inflammation from both angles. That's very important. One of the reasons why the drugs have a lot of side effects is they push inflammation out of one pathway and it winds up in another. When you mix a well-absorbed turmeric, curcumin, with a well-absorbed Boswellia serrata, frankincense, you're coming at inflammation from both sides, but you're leaving enough of that process for healing. So you don't get damage to the kidneys, you don't get bleeding ulcers, you don't get damage to the eyes or the hearing apparatus or damage to the heart. Because when you get the drugs and they so powerfully suppress the COX-2 enzymes, you wind up with swollen legs, a lot of fluid in the legs. It's called peripheral edema. You wind up with high blood pressure, damage to the heart, stroke, heart attack. Not good, not good, not good. You don't get that with the supplement. And yet, coming at the inflammation from both sides, if you mix the frankincense with the turmeric, it's very helpful for knee pain, and it's very safe to use. In fact, both of those herbs are also fantastic for your brain and memory. So that's very interesting. Here's a joint supplement that's great for the brain. So you don't have to take naproxen. You don't have to take ibuprofen. You don't have to take celecoxib. The supplements work very well. In fact, there was a review by Johns Hopkins not very long ago. They looked at a whole bunch of studies on frankincense and on well-absorbed turmeric, and they said there's really no difference the amount of benefit you get from turmeric versus all those drugs. The turmeric works as well as the NSAIDs, but it's light years safer. It's light years safer. And when you mix the turmeric with the boswellia, it's very effective for stiffness, for joint pain, for protecting the knee, for range of motion. That's how much you could bend your knee without pain, how far you could walk without pain, how comfortable you are walking up and down the stairs, restoring your quality of life. These products really do work. They really do. So take a look into that. And by the way, 7 days a week, if you call us, you can discuss directly with one of our nutritionists your issues. There's no charge for that. So thanks for tuning into the Invite Health Podcast. You can find all of our episodes wherever you listen to podcasts for free, or just visit invitehealth.com/podcast. Please subscribe and leave us a review. I hope you do. You can follow us on Twitter and Instagram and Facebook at Invite Health. And I hope to see you next time on another episode of the Invite Health Podcast. And thank you so much for listening. Jerry Hickey signing off.